Integrative Medicine division, or I guess division. And before that, she worked she's a registered nurse, and she was a registered nurse for 18 years in the oncology, in working with lung cancer patients. And over the course of her 18 years, she was looking at the ravages that the cancer did on people's bodies, as well as the extreme complications that the treatments caused people and what it did to their bodies. And she decided that she started working with people and started exercising people while she was an oncology nurse for lung cancer. And she found noticeable improvement in patients, particularly as they were recovering from their surgeries. And so she just decided that she was going to change her career and become a fitness specialist so that she could use exercise as a medium to help cancer patients have a better quality of life as a result of their cancer treatments. And whether they're an actual patient or they're a survivor, she just believed that exercise would help people to have a better quality of life. And I think I think we're all aware of the reasons why. You get the body moving, you get your blood moving, you get your heart moving, you get your muscles pumped up, you start releasing hormones and endorphins and so forth. So with that, she created fitness programs that were offered to cancer patients at MSKCC in the Integrative Medicine. And at first she started working with women, breast cancer patients and survivors. And her classes were wonderful, and they attracted a large number of patients. And as she was doing this, she became aware of that there might be another level that she could take this. And somebody introduced her to a sport called dragon boat racing, where you have 20 people in a boat, and you race for time, 200 meter, 500 meter, and 2,000 meter races. And it's extraordinarily challenging mentally and physically. And she went out on a boat once, and she said this would be a great way for breast cancer survivors and patients to really help overcome their feelings, their depression, the fatigue, mental and physical fatigue that they feel, and give them a sense of purpose and a sense of I can do this, and I'm stronger than my cancer. So in 2009, she organized a dragon boat racing team for breast cancer survivors. In the meantime, she had these fitness classes at Sloan Kettering, and that's sort of a basic background about her. I came to meet her because I'm stage 4 prostate cancer, and my doctor said, Richard, you're going to have to push yourself. You're going to have to be active, and you're going to have to push yourself. And I had no idea what that meant, but as I was, she said that you're incurable, but we have a program that I have a program that will enable us to manage your disease, and it's a hormone deprivation therapy. And I think there are probably a number of people on this call that are familiar with that. It's Lupron, and there's any other possible secondary medications. And over the course of about a year or so, I lost all of my muscle mass, and it hurt as I was walking. I live in New York City, and and walking is a primary means of getting around. And so I was walking down the street, and I'd get to a curb, and God, it hurt to step off the curb, and it hurt to step up on the curb. Unfortunately, in the city, there's a lot of wheelchair ramps at the sidewalks, but I happened to be in a medical office, and there, sticking out of a magazine rack, was this small brochure that had exercise classes at Bendheim, and there there was a class in there for strong bones and healthy muscles. And I said, that's exactly what I needed. So I attended the class, and there were all women in the class, but it was my first day there. Donna had to take me out of the room because she thought I was going to. The color of my face changed. It was very white, and so she got me out of there and had me drinking orange juice. And but I came back and finished up the class, and I came back, week after week, and I gradually began to recover my muscle mass and gain my strength. And that was in 2014. The class has grown, and then so as a result of this, the Strong Bones and Healthy Muscles class, which was all women, I asked her about 3 months after I was going there, asked her if she ever thought about having a class for men. She said she'd love to have a class for men. So I was in the Us Two New York group, and I said, well, I know there's a support group that meets once a month, and there's a lot of guys with prostate cancer in there. And she said, okay, let's go. And so she made a presentation, somewhat, akin to what she's going to be doing today. And she made a presentation.
I lost Richard.
Okay. Can you guys still hear me, or?
Yeah, I hear you again.
Okay. So anyhow, so the class has been going on. We've had she's opened it up so you can just have cancer. You don't have to have prostate cancer, and the guys are all getting stronger and have a much better quality of life. I'm stronger now than I ever was before my diagnosis of cancer, and I'm happier now. I can't believe it. I just, if you would have told me that exercise would give you a better quality of life with a diagnosis of cancer and with the medications I'm taking, I wouldn't believe you. But I'm a very active tennis player now. I'm also on the Dragon Boat team, and I started performing in off-Broadway musicals. It's just changed my life in terms of the energy that I feel and the positive attitude and outlook that I have as a result of the exercise. And so why can exercise do that? Well, Donna will talk about that in her presentation, but for me, I think is that, for one, it was something to look forward to, and I stopped thinking about having cancer, and I was feeling good, and I was feeling better, and I was happier because of the endorphins that were being released. And the PEX class is once a week, but then I would do exercises at home. I didn't go to a gym; I just did them at home. She taught us exercises we could do at home. And, she takes really good care of us, and I have a gentle yoga routine that I do as well, and breathing exercises. Donna Wilson is a big proponent of breathing exercises that only take like 5 minutes, 6 minutes. I do them in the morning, and what a difference she's made in my life. I say to people that my doctor, my medical oncologist saved my life medically, and Donna Wilson saved my life, my quality of life. I'm not making this up. This is the absolute truth, and I am very proud whenever there's an opportunity for Donna to come and talk to people about exercise, because of I've seen what she's done with people, and I've seen the quality of lives that have been improved, and the people on her Dragon Boat team. The oldest member on her team is a 74-year-old woman, and she's on the racing team. I'm only on the rookie team.
Hey, Richard, can you hear me?
Yes.
Richard, this is Donna. Can you hear me?
Yes, I can, Donna. Can you hear me?
Yes, I can. I'm
okay.
on. I just can't get a video, so I just got on, so I can chat away if you'd like. I just don't have the screen where the slides are, but if I can just keep talking if you want me to.
I think so. They asked me just to be a filler until you were able to get connected. So I was just
Okay.
Talking to the people and letting them know how I met you and the difference that you made in my life, you know, with exercise and the quality of my life. And so that was just sort of telling my story, a little bit longer version than what we did at the Cancer Smart, but sort of along those lines. So
okay.
So I guess you're on, and is Rick on and Len, are they on?
Yeah, Len and I are both on. Donna, I'm so sorry. This is the first time this has ever happened to us, and we run these meetings every week, so I just don't know.
I apologize. I'm on a different computer now. I got in on audio, but I don't have the video.
I can see that. So you were able to call in on the phone. So here's what we're going to do, if it's okay by you. We'll get cracking. Why don't you, can you pull up your presentation on your own computer there?
Sure.
So if you pull up the presentation, I will put it on my computer right now, and I will share my screen. So let me just do that. And then if you could just tell me when you want to move to the next slide, I will move the slides along.
Okay, that sounds good.
And hopefully that should work. So just, guys, give me 1 second, and I will bring up the presentation. Okay, and then we'll check and make sure everybody can see it. Okay, so if I now share my screen. Okay, can people see the presentation? How about now? Can you see it now?
Not yet, Rick.
No, not yet.
No? What do you tell me what you're seeing?
Just you.
Just me. Can you see it now? I have two screens, that's the trouble, and I'm not sure which screen I'm sharing.
Nope, not yet.
Okay.
Sharing the one with you.
Yeah, well, that's not me. That's the video cam. So we'll get through.
Well, I have the slides in front of me if you want me to start. I mean, I can do that.
Just give me 1 second and let's try and see if we can start sharing my screen. Okay. Can you see it yet? No.
Yeah.
Yes?
Now you see the sun.
Yep, we see your screen. It's a picture of a sunset.
Okay, so here you go. Now you're going to see it. There you go. Okay? You see it now? Or are you still seeing a sunset?
No, we see it.
There you go. Okay, we are, Donna, you're set to go. We are on your, we're on your opening screen. Keep moving, and just let me know when you need me to move the screen.
Okay. All right. Well, I'm sorry for all the confusion, but here we go. I wish I could see everyone's faces, but that's not possible tonight because I would like you to know I've heard Richard before, and Richard has really been and everybody in the PECS class has really made a difference in their life. I think the most important thing I want to get is I want to feel all of you get motivated on to move. And I'm going to try to explain to you why moving is probably the most important thing you can do. I think when we go to that next slide, lifestyle intervention, when you think about it, is there anything you can do to reduce stress, improve the ability to perform activities of daily living, boost your immune system, and decrease inflammation. I mean, really, when you think about that, it's all the things that you're having trouble with when you're going through this treatment. And the one thing that it is exercise. So, and exercise has been around for a long time, and now the research is showing more and more in each of the different types of cancers. But in prostate cancer, it is definitely shown that it's safe. We know that from all the research that's out there that we see that it decreases fatigue level. There are days that you don't want to get up. There are days that it's really hard to move. But once you start moving and you feel better, then it's like, wow, I liked the way I felt. I need to keep going, not just because there's another thing you're going to learn about your body as well, and as we go on. But fatigue is a big problem. You know as well as I do, the medicines that you're on, you gain weight, you know, and you get a little extra body fat here and there. So the exercise, you know, it's diet and exercise, but it does help you start to feel stronger. When you feel stronger, then you want to eat better. So it's just a sort of a natural way of doing things. The muscle strength, you know, the testosterone is taken away, so muscle mass is gone, and you feel really debilitated and weak. So everything you do is a big effort. By increasing the strength of those muscles, it can happen. And I can say with really strong energy that I've seen change. And I've seen change. Richard and Len are probably the ideal people. They have worked very hard, and they look strong. They stand taller. They have good posture. It makes a huge difference when you start to incorporate resistance training. And we can talk about the types of resistance training. When you get stronger, you improve your balance and your posture. It's just, you know, that the muscles will support your spine, and then your balance will get better, because that's a very big complaint that people come in with me, is that they have poor balance. And of course, then what happens if you stand taller and you feel better, you're going to have a better body image. Bone health is key. We want to strengthen the muscle to strengthen the bone. And osteoporosis is another major problem with people with treatment for prostate cancer. So strengthening the muscle onto the bone will really support the bones better and make them stronger. Also, you're going to just an overall improved energy. And if you have more energy, you have more quality of life. So let's go to the next slide. So how is physical activity really related to your health? Well, as we said, it controls your weight and it increases. But the most important thing on this slide is endurance exercise has been shown to decrease prostate cell growth. Now, they have done this with normal people. They've shown how that things can change. But by doing some endurance training, which is your cardio fitness, improving oxygenation, and improving the blood circulating down to the tissues, they've shown that prostate growth can be maintained or slows down. And I think that people can have seen that you know, you can be in a situation of having stage 3 or stage 4 cancer, and then all of a sudden things just sort of are being maintained. And the thing that changed in your life is that you incorporated exercise. And there's also a link between what is cancer. It's an inflammation. So if we exercise, you have a cascade of things that happen in the muscle by going through and preventing any more cytokinins, which is really an inflammation, and producing myokinins. It's a huge multitude of pathways that go through these pathways to decrease the inflammation in your body. So let's go to the next slide, which are the outcomes that we found. That resistance training cardio fitness. Now, I put there HITT. It's coming out more clearly that many people look at endurance training to decrease tumor growth, and that could be doing something on a bike or a treadmill or walking or an elliptical, something where or walking up a hill that you know that you're increasing your heart rate. But what's coming out is that these long intervals on pieces of equipment isn't as necessary, that they're looking at high intensity training where you are maybe walking, say, for 2 minutes at a very comfortable rate, and then you increase your rate for 1 whole minute to almost to the point that your energy is like you're slightly breathless, that you can still maybe say a word or two, but you're breathless, and then you slow it down for 2 minutes. And that's what interval training is, when you're starting to work really hard and then you rest for a minute or two. If you're on a piece of equipment, let's like take the bike. It could be a recumbent bike, which is a sitting with a seat, a comfortable seat, or an upright seat. And what happens is you put the resistance, say, on 4, and you're really comfortable at a resistance of 4. It's not really taxing you at all, and you're just using the bike. And then for a minute, you increase the resistance up to 8 or 10 to increase the heart rate. At the end of that minute, you go back down to 2. So you can see that it goes back and forth. You do 5 or 6 of those intervals. You've done your exercise, your cardio fitness in about 15 to 16 minutes, and it really works well. But so I think the resistance training, again, I can't stress enough why it's really so important. And I'm going to get to that in a little bit more to explain that it's to do with our aging process as well as not doing anything. So also, it really makes a difference with your treatments and radiation treatments with the fatigue level, that you want to increase muscle strength. You want to maintain that muscle strength. And, you know, you don't have to, you know, when we talk about it, you can do things like, you know, keeping your legs good and strong by doing a wall sit. So you start really slow and you sit upright and you're tuck your tummy in and you're sitting like sitting on a chair, but your back is against the wall to strengthen those leg muscles. Also to do wall push-ups against the wall. You start there, or you're sitting in a chair or on an exercise ball, and you could do upper body weight training. So you don't have to be standing, and you want to really protect yourself. And as I heard Richard say earlier, I'm a very big proponent of knowing how to breathe with exercise. Every time you lift a weight, you breathe out. And as you breathe out, you try to really tuck your tummy in to support your back as well. And obviously, we're going to improve balance. With all of these exercises, a lot of the times we have to strengthen the pelvic floor. And there's exercises that we do to strengthen the pelvic floor. So really that we have a lower incidence, you get a lower incidence of incontinence, or you have less dribbling by strengthening that pelvic floor. Exercise does not affect the PSA, and I wanted to just put that in. But research has really shown that it does do tumor growth. Now, yeah, they're starting to do these in men as well, but in the first studies that they did in rats, if they had the prostate tumor in 2 different groups of mice, and what they did is gave the same amount of tumor cells. One was in a crate that they had the little spinning wheel and he could run all day, and the other one was sedentary just because he didn't have the spinning wheel. Well, after about 3 weeks of doing this, they looked, in fact, the rat that was on the spinning wheel had really no tumor growth, versus the one that was sedentary had major tumor growth. So being sedentary is really not the right thing to do. I'm going to say something else about being sedentary. All of us sit really way too much. Some people on the average person sits something like 10 hours a day. If you're at a computer and that's the type of job you have, then every 50 minutes, get up and just walk around a little bit, or do some chair stands up and down, and move your arms around. But don't just stay in one position for that long, because what happens is you get more sedentary and the muscles get weaker. Next slide. The sad part about this, we know that exercise works, but the most frustration from my perspective is that only 50% of maybe the U.S. population exercises, and less than 20% of people go to the gym. 80% of men and women over the age of 65 that have a cancer diagnosis do not exercise. And that just increases the number of complications that you have with your treatments. It adds to weight gain, it adds to diabetes, it adds to heart disease, it adds to stroke. So all those things really add up to that, plus being over the age of 65. So way back in 2006, the American Cancer Society and the American College of Sports Medicine came up with that all people, and especially people going through cancer treatment, should work out 30 minutes probably a day or 5 days or more to get to a total of 150 minutes a week, which is really not very much, but really was a very conservative amount, but it really does make a difference. Next slide. Well, why do I feel so about this? And we've been talking about it. One of the things is the average age of people getting prostate cancer are their 50s, 60s, and 70s. So what happens in the normal aging process of the body, we start to have decrease in muscle mass in general in our 50s. You could just be an active person, but you might start losing some muscle mass about a 1% a year. And then that picks up speed in your 60s, 70s, and 80s. So you get diagnosed in your 60s, you've already started to lose muscle mass. Now you went on treatment and you've decreased all your testosterone and you've been on other chemos and radiation, and now you're sedentary and you start losing muscle mass faster. The first muscle that starts to go when you get really weak is your thigh muscle, the quadricep. It's a huge muscle. It's one of the largest muscles we have besides your muscle in your buttocks. And what happens is that gets weak. So then just getting up out of a chair and just doing the basic things in life are really difficult. So you can lose, it says, it's 40% of your muscle, between the ages of 50 and 80. And, we all see how our bodies change. I mean, and you see that, we sort of have more movement of skin than we want because we've lost muscle mass. So it's so important that's why keep moving and doing resistance exercise is going to make a difference. And now you can understand, no matter if you become sedentary and frustrated with the fatigue, you're just going to get weaker, have worse balance, and have major strength problems. Let's look at the side effects of your ADT treatment and what happens. All the things that I say that exercise can make better, look at all the side effects that you have with this treatment. You lose muscle mass. You get weight gain, especially around the middle, in the tummy area. You get fatigue. You have loss of bone and you get osteoporosis. You have a decrease in mental sharpness. You have depression and anxiety. You can get anemic and you have a risk of high blood pressure, stroke, and diabetes. So it's really sort of, a no-brainer when you really start saying, wow, I have all these symptoms. Why am I not moving? Why am I not doing this? So I think as I look at the next slide, I think of yourself as think about these questions now. Thinking of your fitness assessment. How many of you actually can honestly say that you exercise and do 150 minutes a week of exercise? How often do you do it? Are you just a weekend warrior that you get those 75 minutes in each Saturday and Sunday, or are you really doing a little bit each day? And do you consider yourself fit? When let's think about this. When you walk up a flight of stairs, are you short of breath? If you walk up a hill, are you short of breath? And if you just go ahead and have to, do something quickly or get it, and all of a sudden you have to sit down because you're exhausted. When you're not physically fit, every muscle contraction in your body takes oxygen. So what happens is that when you're not physically fit, your muscles have to work harder. Your heart has to work harder to pump out oxygen to the rest of your body. So you fatigue quicker because you don't have the conditioning that you should have. So it's that simple why exercise is so important. When I look at an exercise program, I think most of us who are over the age of 50, the first thing we want to remember is that our tendons and ligaments start to shorten a little bit as we get older. So the first thing you want to do when you start an exercise program is to do a light cardio workout. You might just be wanting to walk fast, do some knee lifts, maybe do some very simple squats, and do some stretching so that you can get the heart rate up, do some shoulder circles, do some squats for the knees and the hips, and maybe just do your arms for torso twisting side to side, so to get everything moving. The next is that I'm going to stress is that you do the weight bearing, the weight training. Now you can use elastic bands, you can use hand weights, you can do isometrics. Isometrics can be really done with a dish towel, and you can just pull that towel apart and do a shoulder press and do multitudes of exercises that way. But this is just the consistency of doing it. You don't have to lift heavy weights. The key is that you can use a 3 or a 4 pound weight, but if you do it slowly, the most important thing is when you're doing, say, let's say a shoulder press, where your arms are out to the side and you're going to breathe out and lift the weight over your head with both arms. Well, easily, if you do that quick, it's just moving the joint. What I want you to do is engage the muscle. So what I want you to do is breathe out and really engage that muscle. When we talked about the cardio, that high intensity training, you can do it on the bike, you can do it on a treadmill, you could do it elliptical, you could do a walk, jog, or a walk. I taught somebody today who has stage 4 prostate cancer, and he has some issues with some bone mets, so we don't want to do any jumping. So what we did with him is we set up a program where he does a nice leisurely walk for 2 minutes, and then he's going to do some fast walking where you do, it's like, it's called race walking actually. And what you do is you do heel toe, and you walk really fast using all of the hip and thigh and back muscles. And you do that just for a minute and then you slow down. This way he can get his heart rate up a little bit and then slow down. Yoga and Pilates are you can do for the core. The only thing you have to be careful is if you have any problems with bone metastatic disease to your hips and to your back, you really have to be careful that when you do the Pilates, you want to keep your spine nice and straight and back. You can do a lot of core exercises without doing a crunch. You don't have to do a crunch. That's one of the last exercises you have to do, for getting the core strong. Think about getting the core strong all the time as you're doing any exercise, because as you breathe out and if you pull your abdominal muscles in, you're engaging the core. And yoga, just be careful with some of the kind of the movements, when they're bending over, doing downward dog and the jumping back if you have any problems with your spine. And of course, at the end of this, you always should be stretching. You really want to get a couple of whole good body stretches. So you can stretch your hips, you stretch your thighs, the back of your leg, you stretch your shoulders, your back, and your arms. And it's very important. So actually, when we look at the next slide, designing an exercise program, I don't want you to think of fitness. I don't want you to think of exercise. I want you to just think of keep moving. Just keep moving. Keep things as flexible and as you can. When I talk to anybody, I always want to identify the problems first that they're having with treatment. And what did they do before all of this? There are many people, I heard Richard talking about our Dragon Boat team, that are amazed because they say to me, I've never exercised before. I never went to the gym before. And now I'm really liking this exercise because it's a good routine. So I think we need to know what you did pre, and so we know how to work with you afterwards. Did you ever have any pre-diagnosis injuries, or do you have a history of back problems or shoulder problems? Have you had a rotator cuff injury or a back? So anybody that you're working with really needs to understand what your level is. I like to do a 3-minute step test on all my new clients, and that's a YMC step test where you go up and down. We try to do a 12-inch step, and you go up and down that step for 3 minutes. And then I monitor your heart rate, and then I see what your recovery rate after the 3 minutes. I have you sit down, and then we look at what your recovery rate is 1 minute after the exercise to see how fast you recover. There's a whole rating system that's been researched and based on many normal people of age and your heart rate, so you can see where you fall. Are you average or above average, or are you below average that you're deconditioned and really have to work up to a better level? And it gives me a good level of how far to push people. You want to evaluate your balance. How long can you stand on one foot? I mean, that's a very hard thing to do as we get older, but it's important to know, can you stand on one leg, really with your shoulders down and your chest lifted, and really support your spine with your muscles and lift one leg up, because then that looks like, then you can hold your body on one leg. I really commonly design individual programs, set goals for people, and most importantly, make it fun. Put some fun music on, or some kind of music that you like. Just make it fun. challenge yourself. Like, I did 12 reps of this. Tomorrow I'm going to do 15. I'm going to see how much better I can get. There's a very simple test that the CDC came out with, the Disease Center for Disease Control, that came out and looked at people, and this was what they were trying to evaluate, 65 and plus. If you're 65 to 75, there's a thing called a chair squat, where you sit on the edge of a chair and you go up and down. And if you can do 12 chair squats in 30 seconds, you're considered to be in pretty good physical shape between 65 and 75. If you're 75 to 85, they expect the average person should be able to do 10 chair stands, 10 chair squats in the 30 seconds. So you see that people are all looking at this, trying to find out how we can motivate all of you and educate everyone on moving. So let's look at the next slide as I look at a very simple exercise program here. I looked at breathing exercises, which I'm happy to send out to everyone and give to Rick. But they're very simple, but it really teaches you how breathing in through your nose gets you the depth of respiration, and breathing out through your lips, you get that diaphragm moving up, pushing the air out. The more air you get out, the better breath in, the more oxygen you get in. So you want to coordinate movement, arm movements, with your breathing. The chair squats, which we just said, that 12 reps in 30 seconds should be a challenge for everyone. You can start off slow, but that would be something you could say, gee, I'm going to get to do that. You can do knee lifts. Now, if you're in a weak and a debilitated state, you can start doing knee lifts sitting in a chair. But most importantly, you could do it maybe standing and holding onto a chair, or holding onto something secure and lifting and breathing out as you lift each leg. And you could do it alternating, or you could do 10 on the right leg, 10 on the left leg. Now, cardio fitness, obviously jump rope is great, but not for everybody. But you could do a little bit of jump rope without a real rope, and just, do imaginary jump roping, which most people try to do a little bit. Jogging or walking, as we talked about. Stair climbing, the simplest, best cardiovascular exercise. How many times you look at the stairs and you say, oh, I wish there was an elevator. No, you don't. You want to use those steps. And the most important thing is you put one foot up on that step. You have to breathe out as you lift your body out of that step, because you're lifting your whole body up on that step. That's a lot of body weight on that one leg. So as you go up each step, you breathe out, you'll find that you'll be able to do a lot more and much, much more efficient. That is, I can say, something that I've worked with many, many lung patients with all sorts of lung injuries and disorders, and that makes a huge difference on their ability to strengthen their legs by learning how to breathe correctly. Weight training, isometrics are kind of fun because you can just use the towel, and using the towel you can pull it really taut. Again, I can send you all those if you'd like. And we put the core with the Pilates, but stretching. We don't do as much static stretching anymore. Static stretching is when you hold a stretch for like 20 seconds. But movement stretching, mobilization stretching, so that you can move and keep the flexibility of all those tendons and ligaments into each joint. As we go on, I hope that none of you use any of these excuses. The barriers to keep moving. I'm too tired. I have lack of time. I have lack of motivation. I have lack of discipline. I have lack of interest. I procrastinate. This is a great call to have and a great meeting to have, so people can motivate each other. You can get a buddy on a phone and say, well, what did you do today? And start, maybe even now with today's, technology, you could be on the phone with somebody and talking to them as you're walking and say, look, I just walked 6 blocks. How many blocks did you walk? You can have a friend or a partner to do it. I mean, it's most important to motivate who you're with and just keep them motivated to keep moving. I know that there's days that you really feel excessively tired, and I would agree with that. So, give yourself a day off or another day. What I do with all my patients on chemotherapy is that we look at a log. If you're getting your treatment once every 3 weeks, we know what you get, say, on Monday. You might feel okay Tuesday because sometimes we get steroids before the treatment, but if not, you might feel really tired Tuesday and Wednesday. Well, by Thursday, that's the third day after chemo, get up and start moving. Don't just, the longer you stay in bed, the more sedentary you become, the weaker you become, and the faster you get weaker, and that's the problem. So as we move on to healthy foods, because what happens is, we were always from the old school that we told everybody when you're on treatment, okay, just eat what you can because we know you don't feel well. But, when we say that, it also goes to back our old comfort foods. And comfort foods are a problem because they're usually unhealthy foods, unfortunately. So when I think of what healthy foods is, all kinds of berries, all kinds of deep vegetables, lean protein, chicken, turkey, pork, eggs, fish, salmon, tuna, sardines, olive oil is very healthy, avocado, and the nut oils. Try to stay away from canola oils. Try to stay away from the Western oils and that kind of thing. And, if you want to make things tasty, we'll start learning how to choose spices and herbs to really change the flavoring of things. The most important thing is when you start limiting, you have to limit sugar. Sugar increases inflammation. As you increase inflammation in the body, what happens is that's going to change. You're also making you're going to become insulin resistant, and the insulin resistance to the hormone insulin results in increasing blood sugars. That increasing blood sugars can also lead to diabetes. So you really want to really decrease that. The feeling is with cancer patients, we tend to say limit red meat. I didn't say stop it, but I said limit it, and smoked meats. And I think you want to be careful on your fruits. I mean, there are many fruits that have very, very high sugar, like grapes, and bananas and figs. All the dried fruits you probably should limit or to a small amount. But, not to take them off completely, but to limit them. Don't just eat those kinds of things. When we look at the next exercise, the next is why? Just why do we want to exercise? And I know I've said this many times today, but I'm trying very hard to say to you, I want to try to motivate you. I'm telling you that improved oxygenation to the body, tumors don't grow then, or they have shown little growth. Also, they have shown that with muscle training, you're getting all those mitokinins out, and that's going to, influence metabolism and exerts anti-inflammatory effect. So you need that. You want to be able to recover quickly from your treatments. You want to have more energy. Self-image, fun, we've talked about this, and getting up the stairs and not being breathless that everybody has to wait for you. So it's most importantly that we try to do these things. In summary, exercise is purely safe during and after treatment. That has been with every type of cancer there is. There's been proof of that. Everything is shown that it decreases fatigue and that it improves your strength and your quality of life. It's better with fatigue and things that are most important, because the thing is, when you feel that tired, you just don't feel like doing anything. And I want you to try to feel that you can really enjoy everything. I mean, it's not the end. I mean, this is time to really get up and move. The resistance training, and if we talk about osteoporosis, I know most of you have all had your bone density test. And think about this. How do we improve that bone density? Well, you can think of some high impact things like dancing or hiking, or, do that run walk or the stair climbing, playing doubles tennis. Those kinds of things are going to help. Low impact is on an elliptical or walking or a stair stepper. And strength training is definitely going to improve the strength of the muscle to improve on the bone. And that's lifting weights. You could do it with elastic bands. You can do lifting your own body weight with squats and lunges. You can use weight machines if you want. Heel raises, something very simple. Lifting your heels up 50 times in a row has shown that you can improve the bone density of your hips. So that can be done every day. And you can find that on any YouTube. They talk about it all the time. The most important is that you have to move it so you don't lose it. The research gaps, there's no doubt that, lots and lots of research is being done at the present time to look at decreasing the risk of prostate cancer as well as decreasing the growth of prostate cancer. And, all this stuff will be coming out in a next couple of years, knowing exactly how we need to prescribe exercise for each typical for people that have prostate cancer. We'll be able to tell you what the duration should be, the frequency, and the intensity. I can only say, most importantly, in this last slide, not only are you being treated with medications, but you have to consider exercise is purely medicine. Thank you very much.
Thank you, Donna. This is Len Sierra, and I'm getting feedback on my own voice here. Is that from your end, Rick?
No, it isn't. I'm not hearing any feedback here, Len, so go ahead.
Okay, well, I'll try not to let it throw me off.
I want to turn your sound down. Try turning your sound down a little, Len.
Oh, okay. It's me, is it? How's that? Any better? That's better for me. Can you still hear me?
Yes.
Okay, I can barely hear Donna say yes, but so I just wanted to thank you so much, Donna. Your presentation was so on target. You obviously know your audience very well because you've already answered most of the questions that were submitted. I do have a few that are quite specific. We wouldn't expect you to have addressed them, so let me pass them by you. We have someone who recently had a prostatectomy in August, so they had surgery in August, and he says he waited the required 6 weeks and then hit the gym, and he did various exercises, and he's now noticing he's got some pain in those lower abdomen and groin, like sore muscles. And at the same time, he says he's been having more incontinence. So he's wondering if he overdid it. Do you think he may have pushed too hard too soon? What do you think about that?
I think the one thing is many men after a prostatectomy do have problems with incontinence. I think he's got to, think about exercises that can strengthen the pelvic floor. Part of it, this is a funny way of saying it, and but if you bend your knees a little bit and tighten in the abdominal muscles and then squeeze your butt cheeks so you can prevent from passing any gas, you'll start to strengthen that upward portion of the pelvic floor. And those are the kinds of things that you have to look up to strengthen the pelvic floor. The soreness could be from that you might have overdone it a little bit because 6 weeks isn't long. Sometimes we tell even people 8 weeks. Most importantly, don't be riding the bicycle because that is uncomfortable for most people for quite a while. But I would think that, maybe slow it down a little bit, but, maybe do it, just cut some of the things down. Maybe, I don't know if you're just doing too much cardio or it sounds like maybe you're doing too much groin and hip motion. Like there's that ab and adductor machine in the gym. I probably wouldn't do that yet.
Okay, thank you. At this time, I'd like to ask people to submit questions in the chat box if you have any, and I have a few more for Donna. So you can submit your own questions while I'm posing the next few questions. So we have someone who is asking, I think he's concerned that if he already has osteoporosis and he's doing weightlifting, he may be concerned about some fractures caused by weightlifting. Mm-hmm. He's wondering if there are exercise routines to avoid if you already have osteoporosis.
Okay. So the most important thing is with osteoporosis, yes, you can change osteoporosis and make it better and improve it. I would have to say, I think, Richard, you might dial in here because I believe that your osteoporosis on your last bone density was better. Am I correct to say that?
Yes, it is.
Yeah. So the thing is, what we're saying is that when your one is look at to see, is it your hips, your spine, or your wrist where your osteoporosis is. I would suggest that maybe you do the weight training sitting in the chair, but make sure that you have really a good posture to do it. You're not bending over. You really want to make sure that your form doing each of the exercises is correct, and you're targeting the muscles to push down, especially like, well, let me give you an exercise. If you put your arms over the head in a big wide V and came down to a W, and you pushed your elbows to your back, you're going to strengthen the big muscle in your back, and it's going to give you some pressure on that lower back, and that's called a lat pull down. That's an important exercise. You can improve it. The things that you don't want to do is if your osteoporosis is very severe, you don't want to do a lot of jumping. That's why you want to just maybe do some stationary, like squats that you can do up and down. The chair squat, do that, but you need to strengthen the muscle to put pressure on the bone. But yes, we have seen changes, and I guess Richard is the best one to talk to because Richard has changed his bone density and has improved dramatically.
Thank you, Don.
I had osteoporosis in my upper spine, osteopenia in my lower spine, and osteopenia in my femoral necks. And with the last bone density test, the osteoporosis in my upper spine is almost moved to osteopenia, and the osteopenia in the lower spine and the femoral necks are almost gone. So, perhaps with my next bone mineral density test, the osteopenia will have disappeared and the osteoporosis will have turned into osteopenia. It's amazing. I never would have believed it, but that's what it is.
And the truth is, I would like to add on that Richard's still in treatment. So Richard's still on all of his meds and still had the ability through exercise to improve his bone density. So yes, it can be done. And again, I would be very happy that if some of these questions you wanted to email me personally, Rick, you can surely give my email address out and I can answer them for people.
So I just want to comment on that too, because when I was diagnosed, you could have knocked me over with a feather because I was a distance runner and an endurance athlete, and it turned out that my bone density was minus 2.5 in my spine, and
wow.
I was just amazed. I mean, I would never have known had I not been diagnosed with prostate cancer, and they were about to put me on to LHRH, androgen deprivation therapy, and so they measured my spine, and over a period of 3 years, I improved that bone density to -1. So I went from
Excellent.
minus 2.5 to -1, doing squats with a small amount of weight on my shoulder. As many of you know, I row, which also puts some stress on the spine. But Donna, it's hard to figure exercises for the spine. What do you suggest people that want to improve their bone density in their spine? What type of exercises can they do?
Well, I think there's a couple. One is when you think of a shoulder press and you're going up, you're going to get your upper spine, that cervical area, so you're pressing over the head and down. Then the other one with the lat pull down, which is the big lat muscle. And then when, you're doing rowing and I'm doing paddling, but even if you take a weight and put the weight in front of you and then pull your elbows back, so you're squeezing like your shoulder blades into your spine, that's another. Now, the interesting thing when you do a pullback, if you change the shape of your hand, if you put your hand down, your palm to the floor, you get the upper back. If you do your palms towards each other, it's middle. And if you put your palm up, you get a little lower. So there's ways of getting the spine that you can really make it stronger. A bent over row is another one that can do that. You're sitting, you can do it sitting or standing, and say your left foot is in front of the right and your palm, you're holding the weight and you pull that elbow to your back. But you can look that up online and get the proper way of doing it. So it would be shoulder press, lat pull down, pullbacks, to really get the lower spine and the mid spine involved.
Okay, Donna, it's Len. Once again, I'd like to ask a very specific question. Someone has best approach to the number of sets and reps within a set. Should the weight increase, decrease, or stay the same for the second and third sets? To get an exercise.
Okay, so this is what I would suggest. Whatever you're doing with your first set, you use that weight, and if that, I usually like to do anywhere from 10 to 12 reps, and I like to do 3 sets. Okay, so the thing is, the first set, you say you have a 5-pound weight and you're using it. At the end of 12, it was really easy, but the first set, do the second set and say, you know, that was still really easy. I didn't tire the muscle after using the same weight. The third set, go up a pound and challenge it. But at that third set, if you find at the repetitions of 8, you're like, you've had it, then stop. And you'll keep progressing as you do it consistently and you do it on a regular basis, you'll see that you'll increase the weight. So the key is I like to do anywhere from 10 to 12 reps, and I like to do 3 sets of each particular exercise.
Thank you. Another question. Any advice on plantar fasciitis recovery?
It's a hard one. I've had it myself. Well, I've had it myself. It's like the bottom of your foot gets really, you can take a tennis ball and you roll on the tennis ball. You have to find out why you got the really severe plantar fasciitis. I used to get it when I ran all the time. So I stopped running, and of course it got better. They have these little balls with little projections on it, and you can roll back and forth on the bottom of your foot and do some heel raises, toe raises, ankles, just kind of get everything as flexible as you can. It does take a while to go away. There's no doubt. Make sure you have the proper shoes and make sure that your heels aren't worn out too side and that you have a proper arch in the shoe.
Okay. We have a long distance cyclist who wants to know, how soon after prostate surgery can I comfortably start biking distance and uphills?
I would be very conservative because he's long distance like that I would say that we usually tell people 3 months after a prostatectomy for really that heavy duty cycling.
Okay, thank you. What about the idea of exercising a muscle to failure? The last 1 or 2 reps. Go ahead, I'm sorry.
Well, you could do that. I mean, it's just that sometimes you might tire the muscle to the point of failure, but then you've got to rest that muscle for at least 24 hours. You can't go ahead and keep doing because you will fatigue. And so I would say that that's old school. That was what we used to do, but I don't think it's necessary to do that.
Okay, I have a personal testimonial, I guess you could call this. I had pain in my left hip for years, and it was diagnosed as hip bursitis. Then I went to a physical therapist who said, no, I think it's due to SI joint imbalance. And I went through a whole series of exercises, and it wasn't very successful. I talked to Donna about it, and she told me about something called a Serola, S-E-R-O-L-A, Serola belt, SI belt. I wore this thing for a couple of weeks, and that pain in my left hip disappeared. So I don't know if anybody out there has hip pain or SI joint imbalance. Try this Serola belt. Donna is a genius.
I have to tell you, it does work. I've used it myself, and what it does is when you put it on correctly, it takes pressure off the SI joint, it takes pressure off the pelvic floor, and it just relieves it. I can't tell you how many people I've provided that with, and it all came to, I will tell you how it started. One of my clients had bone mets to the lower spine and was seeing a physical therapist and was really even having troublesome walking. And she said, I'm not supposed to do this, but try this belt. She tried it and was walking normal. And so she came to me and I said, how did you start? How are you walking so well today? And then she showed me the belts, and it was remarkable. Her pain went away, and she just really, it made a huge difference. The truth is, putting it on correctly is most important.
So,
Okay.
so Donna, how about a solution for somebody who needs a new hip?
I don't have those magic fingers.
Oh, you don't? Okay. All right.
This is Richard. This is Richard again, and now I don't know if what I'm about to say is attributable to the exercise, but my bone mets have been unchanged in 2 years, and I tend to believe that exercise has been a factor in that, and my medications have essentially been the same, but to have bone mets unchanged in 2 years is quite a significant result of the treatment plans, and my doctors are all very grateful that I'm exercising, and so I'm going to continue to exercise. I'm not going to take a chance that and let those bone mets get active again.
I think you're right, Richard. This is why it's so important what your story is about, because it is true. You were so consistent when you started, and now you're seeing the change. These are the kinds of things that I could say, but you saying it to other people on the phone here is so important, because you made a huge change. And the fact that you've had sort of, nothing has changed. The tumor growth hasn't gone crazy. Things have really been a very steady state for you. And that's really important.
Yeah. And the Xtandi medication, I'm coming up on 3 years now.
Wow.
So,
Donna?
Yes,
we have the question about drinking whey protein powder, almond milk, and yogurt immediately after lifting weights. Good idea or no?
It's not a bad idea, because you want to have a good, nice protein drink afterwards. I think that most whey proteins are okay. Try to buy a reasonable one. Some of them are, have a lot of little extra junk. There's some that have too much sugar in them, so really look at what you're buying. There's one out there now that is very good, because it has only 3 grams of sugar and 20 grams of protein. But the other side of that coin is, if you drinking and eating that much protein, make sure you have a couple of glasses of water as well. So the one I'll tell you is Iconic, and it's literally 130 calories. It has only 3 grams of sugar, and it has 20 grams of protein. So I think sometimes it gives people a lift afterwards. Having it, I think there's nothing wrong with having a good a protein drink.
Thank you. What about time to exercise? Morning, afternoon, evening, before meal, after a meal?
It really is, as we all have different patterns in our life. I'm a morning person. I know that I exercise much more effectively in the morning than the evening, but I think you have to try to organize your lifestyle the way it is. It doesn't matter when, as much as doing it. That's the most important. Some people find that they have to get up and have a little nourishment first in the morning, and then they go to exercise. Some people like to do it after their full day, and they get energized to have a good evening. So it really is it's very individual. There's not one study out there that says that morning is better than evening or night.
Thank you. Okay, here we have a question I'm not fully sure I understand, but I'm going to read it to you and see what you make of it. Is the shorter intensity interval preferable for multiple reasons? Is the longer, milder anaerobic still valuable?
Okay. Well, that's the long endurance is what you see people doing when you go to the gym, and they're like on the treadmill reading, and they're what happens is you probably initially your heart rate will go up, but because your body gets so comfortable with that rate that it's not as beneficial from a cardiovascular standpoint. what's more, because you're not becoming training to be an athlete, but you're training just to be healthy. The high intensity interval training is much more effective. And that's like going at a speed where you're comfortable and can speak very easily, to a 1 minute exercise where you're just exercising as fast as you can, and you're breathless at the end. So I think about when I'm paddling and I'm racing, that at the end of the race, I can't talk because I'm so tired, but a minute later I'm okay. But that's why that interval is very good, because it gets the heart rate up and down.
Great, thank you. I've got to say that you seem to have answered everyone's questions, Donna. Does anyone else have anything they'd like to ask?
So I've just, I have unmuted everybody, so if there's anybody that didn't get a question or has a question they'd like to ask right now, now's the time. Okay, guess we've exhausted all the questions, Donna. We got off to a rocky start, but I think we cruised through the finish. We must have come through at I don't know how many strokes. I can only talk about rowing, you know. I mean, if I said we came through at 40 strokes a minute, it would be very high. But I don't know how many paddle strokes is high. So it's like
60 to 70.
70. Yeah, well, they're slightly shorter strokes, I think, than you have to take in a scull or in crew. I just want to thank you a huge amount. I'm sorry that we couldn't get you squared away. I have posted some of your videos on the website.
Okay.
And I'm not sure if there are more. I'll send you, if you haven't seen the link, you could look at the link. If there's anything else that we should be posting there, please let us know.
Surely.
And yes, if you can send us your any breathing exercises or anything like that we can make available through the website, we will do that. In the meantime,
okay, I'll be happy to.
Thank you so much. In the meantime, thank you again. Thanks for taking care of my guys in New York, especially Richard and Len.
Well, if you ever come to New York, please come and see me.
I will. I mean, you know, I keep sending folks over your way as often as I can. I got to get that new hip first, though, Donna. I got.
Okay.
The funny thing is, and I'll tell you this, and I haven't figured this out, but the one exercise that really doesn't bother my hip at all is when I'm using the rowing machine. It's really it's amazing that rowing.
Right, because you're using more knees, and you're using, you're pulling with your upper body.
Yeah.
Think about it. So you're not using as much hip. That's probably why.
Yeah. Well, there you go. Anyway, thank you very much. We will close out the meeting, and I will definitely stop by, see you, and thanks to Richard and to Len for helping us out, helping us organize all this. Good night, everybody.
Oh, perfect. Good night.
Thanks, everybody.
Thank you, Donna.
Good night.